Carolina for Kibera's Girls Empowerment Program is a leadership and mentorship project that works with two types of girls. These are teen moms and young girls in school who are either 9 to 19 years. Our focus and choice of adolescent girls is due to their vulnerability, especially in communities such as Kibera. Crises such as the COVID-19 tend to compound existing inequalities, and often in a community, it is mostly the women and girls who suffer the most. During the current pandemic, we have seen girls' education affected, bodily autonomy, lack of access to essential services and products, as well as increased bodily harm through either sexual or gender-based violence. According to the National Council of Administration of Justice, since the announcement of the curfew, by the first 2 weeks, 35% of all cases reported in Kenya were related to sexual and gender-based violence. And we can only assume that the situation is worse considering only 50% of sexual and gender-based violence cases are ever reported in Kenya. In order to appropriately respond to the needs of girls and women during this time, there is need to recognize more additional services as essential, especially sexual and reproductive health. Furthermore, there is need to provide opportunities for women and girls to participate, to continuously relay essential information that's needed to make healthy decisions towards their life, as well as be given an opportunity to participate in problem solving. Over and above, governments, NGOs, and all other related entities need to apply a gender lens when it comes to creating advocacies or interventions that are focused on dealing with issues of COVID-19. To mitigate on the risks that have been presented due to the pandemic, CFK is applying different approaches to support the women and girls in our projects as we continue to weather out the storm. Some of these approaches include provision of essential services and products around sexual and reproductive health. So some of the products that we're really working to provide for our girls are sanitary towels, as well as any other materials and information that would help them make the right decisions towards their bodies and their rights. Furthermore, we have a continuous provision of sexual and reproductive health services where we are scheduling for appointments through phone calls. And for those who would rather have a drop-off of a product like family planning, there's a way we can plan for that to be dropped off at the home. On top of this, we are providing food packs because we understand some of the girls and women under our project are unable to provide for themselves currently due to the economic hardship that is being faced by most homes, not only in Kibera but the world over. With social distancing, mentorship, which we primarily provide through one-on-one contact, has been a bit of a hurdle to provide currently. So we have improvised this is through phone calls, messaging and WhatsApp groups where we have carried on our model for safe spaces, which is usually a group of 10 to 15 girls who form a sisterhood to support each other through life and the different challenges they face as women. So now we are following up and providing counseling and mentorship through phone calls, messaging and WhatsApp groups. So we conduct phone calls, and for those who we feel require additional attention, we can arrange for a home visit. And if need for further intervention, we schedule for them a meeting at the office where they're able to come and access the service that is essential. This includes any form of sexual and reproductive health service as well. This pandemic threatens to undo decades of work towards empowering women. And if no intentional efforts are made to support women through this hard time, then we are likely to see a lot of regression in the progress that has been made, as well as a lot of women falling through the cracks because we did not intentionally plan for women and girls during this time.